My name is Deb Dorsey, and I'm the Housing and Program Manager for the City of Rockford. Welcome to the city's first public hearing for the 2022 Annual Action Plan. The city receives federal funds from the Department of Housing and Urban Development, which support housing and community development programs in Rockford. There are really three objectives for this public hearing. First, to provide an overview of the three federal grant funds that we received from HUD. Second, to provide an update on our accomplishments in 2021. And as we reflect on the accomplishments of the year, the impact of COVID cannot be ignored. Social distancing requirements, remote learning and working, financial issues, and overall health and safety concerns affected all of us on a personal level. At a programmatic level, the effects of the pandemic have caused labor shortages with our vendors and partners, as well as delays and increased prices in materials and supplies needed for our programs. In addition, we reprioritized programming and staffing resources in order to administer millions of dollars in new federal and state COVID-related funds. All of these factors impacted our priorities and accomplishments over the past year in ways that we could not have predicted. And number three, we are asking for ideas and suggestions from the community as we plan for 2022. I would like to now provide an overview of the three program grants that the city receives. Community Development Block Grant, known as CDBG, Home Investment Partnerships Program, known as HOME, and Emergency Solutions Grants, known as ESG. CDBG and HOME programs are administered by the Community and Economic Development Department, and ESG is administered through the Health and Human Services Department. The first grant program is CDBG. The primary objective of the CDBG program is to develop viable urban communities by providing decent housing and a suitable living environment, and by expanding economic opportunities, principally for persons of low and/or moderate income. CDBG funds are quite flexible, but an activity must meet one of three possible national objectives. The first objective is to benefit low and moderate income persons. HUD defines low to moderate income as an income that is at 80% average median income or less. Current income limits in Rockford to be considered low to moderate income are approximately $41,000 for a one-person household and $58,400 for a four-member household. This objective can be met in a few different ways. Through area benefit, in which 51% of the residents are low to moderate income. Limited clientele. This benefits a clientele that is generally presumed to be low to moderate income. It may include such populations as the elderly, severely disabled adults, or homeless. Also, through housing activities and the retention and creation of jobs. The second national objective is to prevent or eliminate slum or blight. This can be done on an area or spot basis, as well as an urban renewal area. And the third is to address urgent community development needs for which there is no other funding available. Eligible uses of CDBG include such items as grant administration, acquisition or demolition of property, residential rehabilitation, public services, or public improvements, just to name a few. The second program is our Home Investment Partnerships Program. The HOME program implements local housing strategies to assist with building, buying, and/or rehabbing affordable housing for rent or home ownership, or providing direct rental assistance to low-income individuals. Here you will see a much smaller number of eligible uses for this program. These funds must be used to address housing needs, whether it is rehabilitation, home ownership, affordable housing developments, or tenant-based rental assistance, and of course, related costs that are required to administer the home grant program. Emergency Solutions Grants. This program helps those who are homeless and those who are in imminent danger of becoming homeless, as well as supporting efforts to coordinate services and housing to the homeless. Eligible uses for ESG include street outreach, emergency shelter, rapid rehousing, homeless prevention, and HMIS, which is the Homeless Management Information System, which is a local information technology system used to collect client-level data. 2022 will be the third year of our 5-year consolidated plan. Back in 2019, the city initiated a 5-year consolidated planning process for 2020 through 2024. We met with community residents, partners, and stakeholders to get feedback about housing and community development needs in our community. Based on community engagement, as well as regional demographic, housing, and economic data, priority needs and strategies were identified. Our annual action plans through 2024 will support these strategies and priorities. High priority needs are those strategies that are expected to be funded during the consolidated plan. They include housing, community development, economic development, homeless, and administration, planning, and management. Low priority needs are for those activities that may not be funded during the CON plan, but the city may support applications for other funding if it is consistent with the needs identified in the consolidated plan. Our low priority need includes other special needs, which would be housing, social services, or accessibility for residents with special needs. Our annual plans and related programs are managed on a calendar year basis, January through December, which coincide with our municipal calendar year budget. In recent years, the city has received its HUD program grant funds anywhere between June and October, and this is after the federal government has approved appropriations and announced grant allocations. This year, the city received its allocation in August. Grant allocations are expended over multiple years, which allows the city to run programs year-round. In 2021, the city had the following HUD funds available to support housing and community development programs. This includes 2021 grant allocations, as well as prior year funding that was available at the beginning of 2021. As you can see, the city received approximately $2.2 million in new CDBG funds and had prior year funding available of approximately $1.9 million. The city received almost $1 million in 2021 home funds this year, and prior year fund availability was approximately the same, but this amount does not include the set aside that's related to our community housing development organizations. And finally, in 2021, we received approximately $185,000 in ESG funds, with prior year funding available of $207,000. This chart shows a breakdown of our 2021 HUD funding by strategy. These percentages are based on the total allocation of 2021 HUD funds, which include CDBG, home, and ESG. This chart does not include any federal funds or state funds directly related to COVID or any other state or grant funds the city may receive. As you can see, based on the HUD funding, 62% of our budget was allocated towards our housing strategy, 15% towards community development, 4% to economic development, 5% to homeless, and 15% to the administration of these program grants. The next slide shows our accomplishments in 2021 by strategy. As mentioned previously, we received our 21 HUD grant funds in August, so many of these accomplishments were funded by prior year grants. Our CDBG and home funds support our housing strategy. So far this year, we've completed 9 single-family housing rehab projects with 28 additional projects in process. We have assisted 2 households with homebuyer assistance. We currently have $20,000 available to support fair housing activities such as testing, education, or outreach. Additionally, the city was awarded a grant through the IDA Single Family Rehab Roof Program back in 2020. This grant of $520,000 is being leveraged with the city's CDBG funds to assist with single-family owner-occupied rehab projects. In July, City Council approved a conditional and preliminary set-aside of up to $800,000 in home funds to support the rehabilitation of Longwood Gardens apartments. The city's home award amount will be determined based on project gap analysis and a complete financial underwriting of the project. The estimated closing date is by Q2 of next year. CHODOs, or Community Housing Development Organizations, are private, nonprofit, community-based organizations that have staff with the capacity to develop affordable housing for the communities that they serve. In order to qualify for designation as a CHODO, the organization must meet certain requirements pertaining to their legal status, organizational structure, capacity, and experience. In 2020, HUD issued a CARES Act waiver, which allows for the CHODO set-aside requirement to be reduced from 15% of the annual grant award to 0%. This waiver flexibility applies to 2017 through 2020 CHODO funds. Per our 2021 annual action plan, we have utilized this waiver and reallocated our 2017 and 2018 CHODO set-aside funds to other home housing strategy programs. Currently, the city has approximately $550,000 available for CHODOs using 2016 and 2019 through 2021 available funds. Also, approximately $49,000 is available for CHODO operating. Community development strategy is supported by the demolition of blighted properties. Year to date, the city has demolished 58 properties, 52 of which were funded by CDBG and 6 with the city's general fund. In February of this year, the city applied for round 5 of the IDA Abandoned Property Program, or APP grant. And in August, we were awarded $75,000. In March of this year, the city was awarded $250,000 through IDA's Strong Communities Program grant. We currently have 11 demolitions in process for this grant, with additional demolitions planned for next year. Economic development. The city received $2.2 million in CDBG coronavirus funds in 2020. These funds are used to assist microenterprise and sole proprietor businesses with working capital. Rounds 1 through 3 were offered in 2020 to eligible businesses. We continue to offer rounds of this program applications through rounds 4 and 5 in 2021 and have assisted 4 businesses year to date and are currently reviewing applications for round 5. 65 total businesses have been assisted through this program. 67% are minority businesses and 50% are women-owned. Remaining funds will be used to support special economic development activities. In addition, the city also received a Local Cure Economic Support Grant Program. This grant award was $900,000 received last year, and in 2021, we have fully expended the grant and assisted an additional 38 businesses. Due to the ongoing impacts of COVID-19, existing CDBG economic development programs were paused in order to implement CARES Act programs as well as other supportive measures. The city has collaborated on several initiatives, including Think Big, which is currently holding a 4-session bi-weekly School of Business seminar to teach aspiring entrepreneurs the basics of opening a sustainable business. The city has also partnered with Transform Rockford's innovation ecosystem to create an online tool that provides guides and resources to open or grow a business in the area. Homeless strategy, which is supported by the city's ESG funds. The focus is on those who are literally homeless and those at imminent risk of homelessness. A 24/7 homeless hotline has been established to ensure that the homeless can access permanent housing as soon as possible. The focus is on moving people out of shelter quickly and into permanent housing. And the local emphasis continues to be on rapid rehousing, street outreach, and coordinated intake. 2019 ESG recipients include Remedies, Second First Church, and Shelter Care Ministries. The proposed ESG recipients for the 2020 funds include Shelter Care Ministries, Remedies, Youth Services Network, and the Institute for Community Alliances. It is anticipated that the 21 ESG funds will go out for RFP in early 2022. The city also received ESG CARES Act or coronavirus funding in 2020. 2 rounds of funding were received for approximately $1.8 million. Looking at individuals who have been assisted this year, January through October, through CARES Act ESG entitlement funds, 168 individuals were assisted through rapid rehousing and 68 through homeless prevention. Through non-entitlement CARES ESG funds, 152 individuals were assisted with rapid rehousing, 42 through outreach, and 106 through emergency shelter. The city has also received $2.1 million in emergency rental assistance, and between April and October of this year has processed 462 applications. It is anticipated that additional funds will be received next year. Also, through the American Rescue Plan, $7.3 million are available in LIHEAP funds, low-income home energy assistance, and $1.4 million in community services block grant. What are the next steps in our planning process? In November, our draft plan will be made available on our website with hard copies at City Hall, our Health and Human Services Department, Rockford Housing Authority, and Rockford Public Library branches. A second public and virtual hearing will be recorded and made available on the city's website. Notice of availability will be published in the paper, the city's social media, as well as direct outreach to neighborhood groups and partner organizations. A 30-day public comment period will take place from November to December, and the plan will be presented to City Council for approval in January. At this time, we do not know when the federal government will approve an appropriations bill for these federal programs. Once approved, HUD will announce the city's grant allocation, city staff will update the budget, and submit the plan to HUD within 45 days. We are inviting you to provide ideas and feedback for the city's 2022 plan to address eligible housing and community development needs in Rockford. During this presentation, I have reviewed the types of activities that are eligible under HUD grant funds, as well as our strategies and priorities as outlined in our 5-year plan. We appreciate your feedback and suggestions. My contact information is listed here, Deb Dorsey at rockfordil.gov, and my phone number is 779-348-7442. Additional resources can be found on the HUD Exchange, and any specific questions regarding CDBG or home programs can be directed to Community and Economic Development, and ESG and homeless questions can be directed to our Health and Human Services Department. Thank you so much for taking the time to participate and watch our public hearing. We look forward to hearing from you.